Baird. I am with Cornerstone Senior Marketing over here. The territory I cover is the northwest corner of the state, and I am your hostess today. So I want to just welcome everybody. And then secondly, what I would like to do is just everybody that's on the line, I want to thank everybody for the opportunity to work with each and every one of you. We know it's a choice that you have. And we think this topic that we're going to bring to you today will be very helpful. I know I get a lot of questions on DSNP and some other things. So we have brought Aetna in, and they are going to speak in regard to the DSNP plan that they have available. That's excellent, by the way, as well as the MyCare Ohio and what that is all about. A couple of items I just want to make mention of before I turn it over. Everyone who's an attendee is muted, so you will not be able to speak. If you have any questions, certainly go ahead and put those in the chat box. We'll make every effort to get those answered for you now. If for some reason we're not able to answer them for you at this time, we'll definitely get answers and we'll get back to you. So with that, what I'm going to do is turn it over. We have a couple of different team members from Aetna on the line. We have Paula Gilliam, and take it away, Paula.
Thank you. Thank you so much, Colleen and Matt. Thank you so much for joining us this morning, everyone. We very much appreciate you joining us this morning to learn more about the dual landscape in Ohio. Albany and I are actually going to go over some information, specifically about how the duals work and how the managed care programs work for duals in the state of Ohio. So again, my name is Paula Gillum. I'm one of the Aetna broker managers, and my partner today is Ms. Albany McIntyre. And I'll actually allow Albany to introduce herself and let you know what it is that she's responsible for and some of the things that she does do. So Albany.
Great. Good morning, everyone, and thank you so much for having us on today. Very excited to talk to you about the dual landscape in Ohio. We know there can definitely be questions out there navigating these waters for sure. But I am the director for DSNP program management for both the Ohio and Kentucky market. So really my job is all things duals and DSNP. And so I really do enjoy working in this space and really do have a heart for the population that we serve. And I look forward to any questions that you have and talking more about our product.
Thanks, Albany. And so we also have a couple of other folks on the line with us this morning from our Ohio team. One of the things as we go through this presentation today, Albany and I shall be kind of like feeding off each other and, splitting the content. So I'm going to go over most of the information, and then Albany will go over the Medicaid piece and the MyCare Ohio and then the model of care. Our Ohio team consists of David Everhart, who is our Director of Medicare Sales in Ohio. And our broker managers, as you see here, we've got Matt Kramer, who takes care of the Akron, Cleveland market. Chad Williard, actually Chad is on this morning. Chad, you can say hi.
Yeah, absolutely. Hello, everyone, and thank you for joining today's training. Really have a phenomenal DSNP product here in the state of Ohio, and Albany is our SME, so to speak. So she's here to help us out. I hope you enjoyed today's content. And as always, if you have any questions, feel free to reach out. Thank you.
Okay. I wasn't sure whether or not Dan and Matt were on because I'm not able to see who's actually on the call yet. But if Dan is out there or if Matt's out there, if you could say hi.
Hi, good morning, everybody. This is Dan Trombley. Like Paula said, I'm up in the Northwest Ohio area, so I work closely with Colleen, echoing Chad's sentiments. Albany is the SME when it comes to DSNP. We have a phenomenal plan, and look forward to helping any way I can. So anything you guys need, just feel free to reach out.
Okay.
And Paula, this is Matt.
Matt, I'm sorry, go ahead.
Hey, good morning. Matt Kramer here. I'm the broker manager for the greater Cleveland area, as well as down through Akron, Ashland, Mansfield, and Worcester. So please feel free to reach out if I can help you at 330-360-5557. Like you see there on the screen, you can feel free to send me an email, a text, or reach out by voice. Again, thanks for joining us this morning. We appreciate it.
Thanks, Matt. I'm sorry, I couldn't see who was on. So, and then myself, I'm normally taking care of the Youngstown, Canton market, but as you lost your broker manager in the Columbus market, I'm actually just pinch hitting for the Columbus market also until we get someone in place that will take over for Shannon Ward, who took a promotion to the director of sales for Kentucky. So congratulations to her. So as we go through, we want to just make sure that you understand what financial assistance is and what people are eligible to get. We want to make sure that you realize that not all financial assistance is Medicaid. A lot of times people get confused and they think that if they ask for help with, medications or with, premiums and what have you, they assume that it's Medicaid, and sometimes they won't even go and actually ask for that assistance. But just knowing what the different programs are out there is going to help you and your customers. So, so the LIS is the extra help or the low income subsidy. And, you just want to make sure that people know what that is. So the LIS is actually going to be for the prescription drugs. It has nothing to do with the premiums for the medical part. It has everything to do with their prescriptions and anything else. The MSPs or the Medicare Savings Program can help pay for Medicare premiums and those type of things. So you just want to make sure that they know the difference. And then, of course, some of these things can overlap. And we're going to be speaking about, how they can overlap in some of those slides that we're going to go over in just a few minutes. But, not all eligible individuals that have LIS will qualify for the Medicare Savings Program or Medicaid benefits. So it's very important to know that. You're probably going to come across a lot of folks that qualify for maybe the low income subsidy, but may not necessarily qualify for the MSP program. But the Medicare Savings Program, if someone has the MSP, they're normally eligible to automatically get the low income subsidy. So just, make sure that you realize the difference between the two. Medicaid is the coverage by the state. It's administered by the state. And then again, people might actually be eligible to get those Medicaid benefits, as well as having access to the MSP and the LIS. That makes them dually eligible. It means that they have both Medicare and Medicaid. Okay, so what is Extra Help? So what is it? It's a federal program to assist folks pay for their RX or their prescription drugs. It can help pay for their monthly premiums. It can pay for their annual Part D deductible. It can also pay for prescription coinsurances and copays. So the differences are in the levels of that low income subsidy that someone might get. So there are actually 4 different levels, and Social Security are the folks that actually determine the levels of their LIS or their low income subsidy. So I always caution brokers or agents to not promise the earth to members, because you may not know what their assets are, and you might go into it saying, well, you're entitled to something. Well, just make sure that you let them know they do have to apply, and Social Security are going to determine that information annually. There are different times they do that. And Albany, do you know when they actually go in and actually do those redeterminations for those LIS benefits? What time of the year?
Well, I can't remember the exact time of the year. I do know that it's an annual determination, but I cannot right now. And I'll try to find that information, but I can't think of exactly the time of the year when they do
Paula,
the LIS.
I can speak to that, because we've been getting, that's the one thing I did want to mention. The criteria for this LIS seems to have changed. We are getting individuals that are, it sounds like, because of some of the new criteria, the process must be going on now because they're getting dropped. And so they're getting, obviously that's causing a lot of questions and confusion. So I believe that process is going on right now.
Mm-hmm. I think probably they might be getting dropped because of that COLA, or
yes, the increase, the COLA adjustment is exactly what seems to have caused this. And And I will mention that we have some background information on that. So if anybody's interested, but I read through it yesterday, and the criteria, what they're actually counting now seems to be definitely different as well.
Okay. So the levels, there's still 4 levels, and you'll see here the LAS levels are 1, 2, 3, 4, and depending on the level that that person gets, is going to determine how much they're actually going to pay or get for premium help, whether or not they're actually going to pay a deductible, and how much they're going to be actually paying out of pocket for their prescriptions. So for example here, if someone has an LAS level 3, and let's say they're actually on just a regular MAPD plan that has prescription drugs included, when they actually go to pick up their medications, they're actually going to get 100% premium help. There is no deductible, and they will be paying 0 for those prescription drugs when they go to pick up those medications, and they have no co-payment. Versus someone who may be a level 4, they're actually getting partial extra help. They're going to be subject to a deductible, and they're also going to be subject to co-payments up to 15%. So it's very important that when you're speaking to someone that you understand what their level of help is going to be, so that you can give them the correct information. You can also go to sites such as Medicare.gov or the National Council on Aging to get this information. One of the nice things, and I do need to change this, is that if you're looking up a client's level of extra help or LIS, right now you can actually go into the Ascend application and look it up, but you can also look it up in the new Think Agent tool. And it's really nice to be able to go look it up. It's going to show you exactly how much they're going to be paying, and it's going to tell you exactly what level that they have. So that's a really nice tool that you have in there to be able to use. So again, there are different levels. There are actually 4 different levels of extra help. So the full extra help, of course, this person is the 100% LAS covered. It means they'll pay if they qualify for that, they should pay no more than $3.95 for their generic drugs and $9.85 for any brand name drugs. And if they're partial, it depends on their level of LAS eligibility, which can run anywhere from 75%, 50%, or 25%. So again, just make sure that you're double checking, and then this information we will be sending out to you so that you have the information on what those thresholds are. And again, if you have any questions on this whilst I'm talking or whilst we are talking, please put it in the chat box, and then Colleen or one of us can make sure that we get back to you on this. So according to the Social Security Administration, extra help is estimated to be worth about $5,000 per year per person. So many people that qualify do not know. One of the nice things that we have in our producer world is a site that's called Benefits Checkup. It's also available to you when you go into the Think Agent application. So you're able to go in and see whether or not they qualify for any additional help rather than going directly to the Social Security Administration to apply for your extra help. Now, a beneficiary will automatically qualify for extra help and will not need to complete any additional applications if they receive Medicaid and they also have Medicare. Also, if you know that they have the Medicare Savings Program, and if they receive SSI and also has Medicare. So there are ways in which they can actually automatically get this, this extra help. And I'm going to go into the Medicare Savings Program now. So as I said before, with the Medicare Savings Program, this is the way for folks to actually get assistance with the medical part of their premiums or their payments. So this is the program that they can get, and they may pay for their Medicare Part A, which is their hospital insurance, the Part B, which is the medical, and it can help pay with the deductibles, co-insurance, and co-payments, depending on the category that they're actually receiving. So you'll see here there are actually 4 categories. There's the qualified Medicare beneficiary, which is the QMBs that we call them. There's the specified low-income Medicare beneficiaries, or the SLIM-Bs. There's the QI program, or qualifying individuals, or the qualified disabled and working individuals, or QDWI program. And I do believe that in the state of Ohio, I don't think there are any QDWIs as of now. Is that correct, Albany?
Yeah, that's still correct. Per the CMS data that we looked at, we still are showing no QDWI individuals in the state of Ohio.
Okay, and that's not to mean that they won't, you won't ever see one, but these are folks who are actually disabled and now gone back to work. And so the criteria is a little bit different for them when it comes to income and assets. So again, it's based on their income and all the rest of that. And it changes annually. And again, there's a certain time of the year that they do this, they actually set these program parameters up. And I'm not sure when it is, but you'll see it change yearly at some point. And usually it comes out at a certain time of the year, and I just can't remember when it is. So what does the Medicare Savings Program help pay for? Well, you'll see here with the 4 different stages, you've got the qualified Medicare beneficiaries, or the QMBs. So this program can help pay for the Part A premiums, Part B premiums, deductibles, coinsurance, and copays. With the specified low-income beneficiaries, or SLIM-Bs, it helps pay for the Part B premiums. For qualified individuals, it also helps pay for the Part B premiums. And for the qualified disabled, it helps pay for the Part A premiums because, of course, that person's gone back to work. So what you'll hear us talking about in a little bit is about cost sharing. And this is what we're talking about when we're talking about cost sharing, the fact that folks are actually paying money out of their pockets. What kind of money are they having to pay out of their pockets? Is it a percentage or is it nothing? And so when you hear us talk about cost share protections, that's what we will be talking about. So as you see here, this is just a screenshot that's going to show the income and resource limits. And so when you're looking at here, these are the income and resource limits for these folks based on whether or not they're individuals or a married couple. So if someone's a QMB and they are single, these are their income limits, is $1,094. And if they're a married couple, it's $1,472. So those are the income limits. And then you have to also look at their other resources. What else do they have? Stocks, bonds, those types of things. So remember, that's one of the reasons why you can't tell someone, yes, you're entitled to this. You can say, yes, I suggest that you actually go in and apply, but don't ever tell anyone that they definitely qualify, because that's not something that we can actually do for them. So dual eligibles and Medicaid, how does it work? So who is a dual eligible? So for a dual eligible person, they have to be eligible for Medicare, either by having A and or B. They also have to receive assistance to get assistance with their Part A and Part B premiums, and receive assistance with their cost shares for Medicare, and be eligible to receive full Medicaid benefits. So then you'll see they're Medicare and Medicaid dual eligibles. So again, this is the criteria: enrolled in Medicare Part A and or B, and receive full Medicaid benefits or assistance with their premiums or their cost shares, as I was alluding to earlier. So just some information here. 19% of Medicare eligibles are dually eligible. A lot of folks are still not enrolled in any type of D-SNP plan, and they can actually save over $28,000 in annual spend for a dual eligible person. So it can be, substantial assistance to them, especially if they don't know that help is out there. And that's one thing that we do, that, you as that trusted advisor are that person that's going to be that go-to that can assist those folks, working out, how do I go about applying for any of this stuff and what does it mean to me? So I was talking about cost share protections earlier. And so the MSP levels, or the Medicare Savings Program levels, and Medicaid eligibility categories, there are 7. You'll see here there's the QMB pluses, the FBDEs, which is full benefit dual eligible, the SlimB pluses, the QMBs, the SlimBs, the QDWIs, and the QIs. These folks here, the QMB pluses, the FBDEs, the SlimB pluses, and the QMBs, all will be eligible to enroll in an Aetna D-SNP for 2022. Now, I'm just talking about the Aetna D-SNPs because other carriers might have different criteria. We are actually taking care of the folks that are actually cost share protected. So for 2022, these are the 4 eligibility levels that are actually cost share protected. These are the QMB pluses, the FBDEs, the SlimB pluses, and the qualified Medicare beneficiaries. These are all cost share protected. That just means that they are not having to pay anything out of their pocket for their medical care. Now you'll see here on the bottom, what do they receive? Well, the QMB is they're fully cost share protected, and they actually receive full Medicaid benefits. But if you come over here to a QMB, they're cost share protected, which means that they're not going to be paying anything out of their pocket for their medical, but they don't have full Medicaid benefits. So you know what? They're not going to be paying anything out of pocket for their medical costs or anything like that. And for Aetna's D-SNP program, again, they'll have nothing out of pocket, but it's important to know what they're entitled to, what they're eligible for. And of course, these are in the other purple, I should say. These are partial duals. So the SlimBs, the QDWIs, and QIs, they are not cost share protected, and they do not have full Medicaid benefits. Any questions on this? Because that's usually the part that people get confused over. Any questions, Colleen?
No, nothing on this. There's one question just back in regard to Think Agent and where you find the check for the status. And so we can just cover that. Yeah, we can just probably cover that. I figured we could cover that at the end with any extra Q&A. Yep.
Okay, sure, we'll do. Okay. And then we have the full benefit dual eligibles, or FBDEs. And so these beneficiaries, they don't meet the income or resource limits or the criteria for the QMB or the SlimB, but they're eligible for Medicaid by a category. So maybe they're medically needy, there's something going on with them. Maybe they're institutionalized. They maybe have some waivers within their community that they have, but it just means that they're actually Medicaid and Medicare and Medicaid. So that's also one of the reasons why you never want to say to someone, well, you're not eligible for this because you think that their income is too high. They may qualify as an FBDE because of their medically needy status or because they have a waiver. So, we just want to make sure that, you're aware of that and that you're giving them the correct information. Okay. So, again, Medicaid generally does not pay out-of-pocket costs for deductible, premium, co-insurance, or co-pay payments for the prescription drug coverage. That is where the extra help comes in. And just remember that program is not Medicaid, but it does work in conjunction with the program. So I'm actually going to hand it over to Albany now. We're going to go through the Medicare and Medicaid plans and what is MyCare Ohio. So Albany, I'm going to hand it over to you.
Great, thank you so much. And as we did see the question that was in the chat, specifically asking about what does cost share protected mean. So everyone can take a look at that. You've got a couple of responses there, but it basically means that group will not pay any Medicare Part A and B deductibles, co-insurance, and co-payments, so long as they maintain their eligibility. And then I know Paula will talk a little bit more about that as well once we get into specifics about Aetna's D-SNP product. So I wanted to just acknowledge that question. But to get us kicked off here, I'd like to start with this chart. It spans a couple different slides, but we oftentimes recognize that you may not only be selling the D-SNP product out there. You may also work with your non-D-SNP population with Medicare Advantage. But then also alongside that, although you may not specifically work with these individuals, but we know that in Ohio, we have that the MMP, or the MyCare Ohio demonstration. So I just like to start with just, high level, what are some of the comparison or features of each of those, and how they may be similar or different in each of these key categories here. So on a basic level, just starting out, like what type of plan is a D-SNP plan, is a Medicare Medicaid plan? And so our MAPD plans, their Medicare Advantage plans, our D-SNP plan is also a Medicare Advantage plan. The MMP plans that participate with MyCare Ohio, those were created as part of the CMS Financial Alignment Demonstration, and those plans are not considered a Medicare Advantage plan. So there you'll see, definitely that first on the layer of everything, a difference there. In terms of that second row, our enrollment categories, anyone who's Medicare eligible, can enroll in an MAPD product. As Paula was just walking through, when it comes to our dual eligible special needs plan, this plan targets individuals eligible for both Medicare and some level of Medicaid. And it can also include those full benefit dual eligibles, those that have that NSP category, or those that may not, as Paula just walked through, include those additional individuals as well. One of the differences between the D-SNP and the MMP is, as Paula highlighted, that QIMBY only group. Again, those are those folks who they have that QIMBY MSP category, but they do not have full Medicaid benefits. Where those individuals are eligible for our D-SNP plan. However, when it comes to the MMP or the MyCare Ohio plan, that group of individuals are not eligible. The MMP only enrolls individuals with full Medicaid and Medicare benefits. So I wanted to highlight that kind of just as a difference that you will see there between the D-SNP and the MMP. In terms of how individuals enroll, you have your traditional Medicare enrollment timeframes and processes for your MAPD. The same applies for all intents and purposes for your D-SNP members. However, our D-SNP members do have that quarterly SEP during those first 3 quarters of the calendar year. And then, of course, they also have that AEP period as well. So you definitely have those additional opportunities there with our dual eligible population, with them having the option to switch or change plans on a quarterly basis, in addition to that AEP. Individuals on an MMP or in MyCare Ohio, those individuals are passively enrolled into an MMP plan with the option to then opt out. We'll talk more about that here in a second, and to receive their Medicare differently. So either from Medicare fee-for-service or Medicare Advantage. And so that's also one of the differences in terms of how enrollment goes with the D-SNP and MMP. In terms of covered benefits, your MAPD plan is going to cover your Medicare primary and acute services. And, oftentimes there's that option there for the MAPD plans to offer those supplemental benefits. When it comes to the D-SNP plan, again, we have those Medicare primary and acute services. And then what we have, those options to cover those supplemental benefits as well. And on a D-SNP product, what you will usually see are those more robust supplemental benefits. For example, at the D-SNP, we have that $6,000 dental and the $75 Healthy Foods card. Paula will talk more about that as we go through. So you may see a more robust supplemental benefit package as opposed to what you may traditionally see on an MMP or a non-D-SNP MAPD plan. And then what makes the MMP unique is that the MMP actually has one set of comprehensive benefits. It includes all the Medicare and Medicaid benefits underneath one plan. And it also has, of course, that those coordination of those benefits, and they also have the option to offer supplemental benefits as well. Next slide, please. I'm not going to hit on these too much. Just to say that when it comes to how, the plans contract and then different alignment, with Medicare and Medicaid, as you can see, it's not applicable. We're not talking about the non-D-SNP MAPD plans. We're talking about the D-SNP and the MMPs. This just highlights, just what some of those differences are I always just include this in there just to say that there are some differences for how we work with the state, how we work with Medicare, and then the alignment between Medicare and Medicaid as well. And next slide. Care management, I'm going to take just a second on because, and we'll talk more about the D-SNP care management, here later on. But each MAPD, D-SNP, MMP offers some level of care management. Usually an MAPD is more targeted care management for those possible high-risk members. When it comes to the D-SNP, our D-SNP, every member in our D-SNP receives a care manager. We're required to have a dedicated model of care and to help members coordinate with Medicaid. The MMP, they have a greater alignment, if you will, integration of those Medicare and Medicaid services. So again, each member receives a care manager. They are also required to have that model of care. And you'll usually see a greater coordination of care there since they are responsible for both the Medicare and Medicaid services, and it's underneath that one plan. So I wanted to highlight that as well. And then when it comes to our provider network and billing, of course, the MAPD has the Medicare only network. Our D-SNP, so the provider contracts with our D-SNP to provide those Medicare services, and then they may contract with either fee-for-service Medicaid or a Medicaid Advantage organization for the Medicaid services. And what usually happens is the provider is going to bill Medicare first as primary. Then the provider will go ahead and bill whoever is covering that member's Medicaid as secondary. And so you'll see that there, and providers, they know where to get the information on how to do that. And then with the MMP, providers may actually have a contract with that MMP to provide both those Medicare and Medicaid services. So providers may receive just the one payment from the MMP, which means they're billing just that one entity for both the Medicare and Medicaid. And so all I want to see if on the next slide, okay, so I want to just stop here for a second. I said a whole lot there. So I want to see if there are any questions. And I want to go to the chat. I see a question here from.
Excuse me, Albany.
Okay.
I did get a question through the Q&A.
Okay.
I don't see the name, but they are asking. The question is: are you saying there are certain plans eligible for Aetna D-SNP but not MyCare Ohio?
Certain members, or is that they're asking? Let me make sure I answer this correctly. So yes, Paula, can you go back? If the question is, are there certain individuals that are eligible for our D-SNP that are not eligible for the MMP? The answer is yes. Paula, can you go back to that chart that shows that has that red box there that had the cost year protection and kind of highlighted everything? Yeah, just right here really quick. And so you see we have those within that red box, those 4 categories are eligible for Aetna's D-SNP. So you see where you have those Quimby's plus full Medicaid, you have your full benefit dual eligibles, which they're not an MSP category, but they have Medicare and full Medicaid. And then you have your SlimB pluses, which have the SlimB plus full Medicaid. These are considered your full duals, so they have full Medicaid and full Medicare coverage. These 3 categories are who are eligible for the MMP. They have to have full Medicaid and full Medicare to be enrolled in an MMP plan. Now, Aetna's D-SNP, we take it a step further, and we also include those Quimby-only individuals. And those individuals, they are still cost share protected, which means that they're not going to have any Medicare Part A or B premiums, co-insurance, co-pays, similar to those other 3 I just mentioned. But yes, so we include that extra category of eligibility for our D-SNP. And I hope that answers the question. Okay, then there's also a question, how would we as an agent know when the more expensive Medicare Medicaid coordination would be in the best interest of the beneficiary, rather than asking for an opt-out of MyCare Ohio? This is a very good question, and I think, and I really appreciate that this question is coming through, because what this says to me is what I've already known, is that, when you're working with the members, you want to make sure you're finding the most appropriate, the best spot, and giving the members the best possible information. Now, the answer to this question is not as straightforward or as easy as that, because it's really going to depend on the member's needs. So remember that our DSNP also offers, and you'll hear this a little bit later. I'll talk about our care management process. Every member on our DSNP, they'll also get a care manager. So they'll be in care management with the care management team, and those members will help, to coordinate those Medicaid benefits. Now, because the benefits within the MMP, they're all Medicare and Medicaid are underneath that one umbrella. What I can say here is it's going to depend on the member's needs. And that's where, just having that conversation with the member, understanding what their needs are, things like that. You may be able to kind of help them to figure out what's going to be in their best interest. If you have a member that may have, really complex conditions and can really benefit from having that Medicare and Medicaid underneath one umbrella or whatnot, then maybe. But you also may have those members who, may want some of the additional supplemental benefits that the DSNP may offer, or may have different needs, or whatever the case is. So it's not a straight answer. It's just really going to depend on the member's needs and ultimately come down to the member making a choice on what's going to be in the best interest for them. What I'm also providing in this deck, and Paul, we can make sure they get, that slide, is a link to some of the MyCare Ohio FAQs, and then also some of the additional benefits that the MMPs may offer as well. And it's just to equip you with information in case the clients that you're working with have questions. But it's going to be individualized, and it's really going to depend on what the member needs and kind of that member choice. It's kind of them looking at, here are the benefits and such of both, and then making that choice on what's going to work best for them. All right, so what is MyCare Ohio? It is a demonstration program in Ohio, jointly administered by both CMS and the Ohio Department of Medicaid. It is only in 29 of our 88 counties in Ohio. And as I said before, members have to have full Medicare and also full Medicaid and be 18 or older. There are a subset of individuals that may not be eligible, that cannot enroll in MyCare. For example, if you're in Northeast or specifically the Cleveland area, you have an individual that's enrolled in PACE. They can't be in PACE and then also in the MyCare Ohio program. So I wanted to point that out. And then there are some other exclusion criteria there too. But the benefits for MyCare has full Medicare benefits, including prescription drugs. It has the full Medicaid benefit package. And then it also may include some of those long-term services and supports. So nursing facility care, but then also some of those services that members might receive in their home, known as home and community-based waiver services. So enrolling in the MyCare Ohio plan, as I mentioned earlier, it is a passive enrollment process, which simply means that the Department of Medicaid, they're going to automatically enroll individuals into a MyCare Ohio plan at first, and then the members must make an active choice to opt out of receiving their Medicare services from that plan. However, enrollment in an MMP in those 29 counties for members who are eligible, it is mandatory for their Medicaid benefits. So what that means is, you all may have already come across this, you can have members that are enrolled in, let's say, Aetna's DSNP, but they're received for their Medicare services and receiving their Medicaid from one of those MMP plans, depending on what part of the state that member lives in. And so that's where some of that coordination really becomes key, and where Aetna's DSNP will help to coordinate even with those MMP plans for those Medicaid benefits. And thank you, Paula. And so here's a map. I like this map. I hope you guys find it really helpful. But our DSNP is in 48 counties across Ohio. So all those shaded counties that are not gray is where our DSNP is for 2022. And of those, we have 20 counties where the MMP demonstration does not exist. So those, that very light purple that you see on this map, that's where Aetna's DSNP is, and the MMP demonstration is not in those counties. Okay, those light purple counties there. There are 20 of those across the state. And then there are 28 counties where the MMP demonstration does overlap with Aetna's DSNP. So I'd like to just highlight that and point that out. And then, for those who are in Central and then, the Northwest and the southwest corner, we do have the Aetna MMP that's participating in those 13 counties that are there, and I listed them there just so folks can have them as reference. And as I said, members enrolled in Aetna's D-SNP for their Medicare services, they may be receiving their Medicaid services from Medicaid fee-for-service or from an MMP if that member lives in an MMP county and is eligible for the program. I just want to stop there really quick and see if there are questions about that.
I did get Albany a question through the Q&A, and it's a pretty common question. The individual is mentioning that they kind of get stuck on what to, I think it kind of ties back to that question you were just asking, or what you were just speaking about, you know, which is better to do MyCare Ohio or, you know, a D-SNP option. But they said they get stuck on the what to do with somebody's Medicaid. That's not really something that an agent would get involved in, or is it? Can you speak to that a little further?
Yeah, so the one thing I'll say, we'll talk about it with this slide too on educating your clients, is, you know, you're helping the members decide where they want to get their Medicare coverage, you know, so whether or not it's a D-SNP right for you. What I'll say here, and this is very important because that does not impact, it will not make the member ineligible for their Medicaid services. And so they can continue to get their Medicaid the way that they are getting it today, regardless if they're enrolling in an MAP, a Medicare Advantage plan, or a D-SNP product. You know, their Medicaid is not, they can get their Medicaid the way they are today. And I always recommend, if members have questions about their Medicaid benefits, always feel free to refer them to the Medicaid hotline. There is a number at the bottom of this screen here that I want to highlight because they can answer any of those questions for the member. Because what's important here is as you're deciding which plan is best for your clients and based off of their specific needs and preferences, you know, making sure that the members know that if they make a choice, for example, to opt out of the their MyCare plan, they want to receive their Medicare separately, the client will not lose their Medicaid coverage or their waiver services that they are currently getting. They're just going to get their Medicare differently. They can continue to get their Medicaid the way that they're getting it today, of course, as long as they remain eligible. And so I always recommend, Medicaid can be very complicated. I'm sure you all know that. I worked for Medicaid for quite some years, and it is still complicated. So I always recommend, you know, if your clients have questions about their Medicaid benefits specifically, you know, what's going to happen to my Medicaid benefits or anything like that, they can always be reassured through that Medicaid hotline that they will not lose their Medicaid benefits as long as they're eligible. They're not going to lose their waiver services as long as they maintain eligibility. And what's changing for them is how they're choosing to get their Medicare services. They may have looked and said, you know what, I think this D-SNP option is a great choice for me. You know, you have a lot of those great benefits and things like that that I can really use. So that's what I want to go with. Their Medicaid is not touched by them making that choice. I hope that helps. If not, ask me a clarifying question.
So Albany, there's another question. This individual is saying that they heard that the July pass enrollment will not be happening. I've not heard anything about on the Medicare side, the passives changing. We know Medicaid is actually going to be going to a passive enrollment. Have you heard anything about that on the Medicare side?
So there's nothing changing
Right.
with how folks enroll for our D-SNP or anything like that. I know there's been this buzz out there. There's an article I think that was out that was specifically talking about what's happening with the traditional Medicaid managed care program.
Right.
And again, that's going to be your non-dual population. And that's where they reference those 3 million individuals who are currently receiving Medicaid managed care may have to make another choice on which managed care plan is providing their care. That does not impact our dual population here in Ohio. That's specific to the traditional Medicaid managed care plan, so your non-dual population. I know I've gotten that question a couple times, so I'm glad you all asked. But nothing at this point that I'm aware of is changing specific to our dual population in Ohio. And that does not impact our D-SNP or enrollment in our D-SNP at all. So just an FYI there.
Yep.
And then I saw the note there, the Medicaid provider is made on the opt-out form. I don't know if that was a question or not, Charles. If so, let me know and I can answer, or if you're just making a general statement. But then I see the question from Brian, what kind of home and community-based services could they lose if they sign up for a DSNP? The members will not lose their waiver services by signing up for a DSNP. That's their Medicaid-specific benefit. The members choosing to get their Medicare through a DSNP or an MAPD plan, it is not going to impact the services that they're eligible for under Medicaid, and that includes their home and community-based waiver services. So they should not lose any of those services. Again, as long as they are still eligible, they're going to continue to get those services. So I wanted to make sure I answered that question. Okay. Let's see. All right, Paula. And then here are just some resources for you, just specific to MyCare. If you're so inclined, want some more information, it talks about the opt-out process and things like that. So there's that link to the FAQ document, and then there's also a link to the benefit comparison chart. If you're just interested in, you know, a little bit about the services that supplemental benefits that may or may not be offered through those MMPs. And Paula, I'm going to turn it back to you to talk about the Aetna's DSNP in Ohio.
Sure. Thank you so much, Albany. Some great information. And, you know, we're coming up to the top of the hour, so I'm going to go over our DSNP here in Ohio. And then if we have enough time, Albany will go over what our model of care looks like. So if you want to stay on with us, you can. So thank you so much for Albany. And we will be sending out this presentation so that you'll have the contact information that you might need. So as we said at the beginning, Aetna does have a DSNP program that we run in Ohio. We've had it for a couple of years now. And for 2022, we're actually only going to be enrolling members that are cost share protected into our dual plan. Those are folks that are QMB, QMB pluses, SlimB pluses, and FBDEs. That means that they're cost share protected, which means that they're not going to be paying any out-of-pocket costs for their health care as long as they remain eligible. The folks that are SlimBs and QIs will not be eligible to actually enroll into our program. So it doesn't mean that they cannot enroll into an Aetna plan, but what you would need to do is enroll them into one of our traditional MAPD programs. So again, this is just the same screenshot that we had earlier, which shows you which ones are full duals and get the that are fully duals or get full Medicaid benefits or partial Medicaid benefits. These are the 4 categories that actually have that you could enroll into our plan: the QMB pluses, the FBDEs, the SlimB pluses, and the QMBs. These other 3, again, as for 2022, they will no longer be allowed to enroll in our program. So we had quite a bit of expansion going on in Ohio for 2022. We've had some really great responses from all of you selling our products, and you know, we feel that it's best in class. And some of the highlights for you, again, your members will not have any cost sharing for anything as long as they remain eligible. So we're going to be taking the QMBs, the QMB pluses, the SlimB pluses, and the FBDEs. As you see here, they will not be subject to any Part B premiums. Then, you know, we're not going to be asking them for any money. They're not going to be paying for any Part C premium. So there's no cost to them for the plan. Also huge for us for 2022 is no matter what LIS level or level of extra help, they will also not pay anything out of their pocket for those prescription drugs as long as those prescription drugs are in our formulary. So that was a huge change for us for 2022. So unlike 2021, when they may have had some cost sharing for their prescription drugs. So Medicare Part A and Part B cost shares are all cost share protected. And this is what our plan looks like. So I'm not going to go through everything, but what you should know is that As long as that member lives in that service area, they're QMB, QMB Plus, and FBDE, or Slim B Plus, they will be eligible for these benefits as long as they're using providers which are within our network, or they have drugs that are in our formulary. They will not pay anything out of their pocket, whether or not it's for their medical or for their prescription drugs. And like I said, we really feel this is our best in class. They have a zero Part D. They'll pay zero for their Part D prescription drugs. They have this $6,000 dental benefit, which, if you're out there selling D-SNP, I very much doubt you'll see anyone in the state of Ohio, carrier-wise, that has such a strong offering as we do. That includes all dental codes except teeth whitening. We have a $515 per year vision benefit. The over-the-counter allowance is $240 per quarter. That is through CVS. And for 2022, they also brought out the Healthy Foods card at $75 per month, which is a really, really nice benefit. They're able to use places such as Walmart or Giant Eagle and Kroger. They have 60 trips, non-emergency transportation trips, 60 trips per year. They've got a full prevention, things like grab bars and what have you. The hearing aid benefits $2,000 per year, which is $4,000. They have the silver sneakers. They have the meals at home. Some really, really robust benefits are here in this program for your members. They also have the personal emergency response system. So here, you'll see here the dental benefit, and again, very, very robust dental. It includes things such as dentures, implants, those types of things that you normally don't get. That vision allowance, the transportation, works very well. This is probably my favorite, this Healthy Foods card. And, we were asked about it a couple of years ago, and they were able to bring this to our clients. And it really is a nice benefit to your members going through. And so, again, if you had members that actually were on our D-SNP last year for 2021, you may have had members that actually were paying some co-pays for their drugs. But the member will pay zero for all covered drugs, tiers 1 through 5, at all preferred and standard network pharmacies. So that was a huge savings, even for some of your members that already were on our plans. So, again, we have that coordination of Medicaid services. And as Albany says, we have that, we have those case managers and what have you, and we have that model of care that we use. And we're able to also speak to the case managers that actually deal with the MyCare Ohio plan. So if there's a case manager that's working with MyCare Ohio, our case manager for Medicare is actually able to have conversations with them. So we're able to assist them with all kinds of different things. Our coordination of care, our case managers or our advocates are also able to remind our members to, sign up for their eligibility redetermination process. So they're able to assist them with that. They can assist them with grievances and appeals. They can actually assist them with looking up providers. They can help them with, maybe their transportation needs. There's a lot of different things that they can actually assist them with. And so before I go any further, before Albany, talks about how that model of care works, I want to see whether or not there were any questions in the chat box. And again, I know that we're coming up to the top of the hour. We've got about 4 minutes, but if you can stay a couple more minutes after 11, we'd appreciate it if not. But if you have any questions before I send it over to Albany to talk about our model of care.
There is one in the chat. It asks about what kind of home or community-based waiver services would they lose if they sign up for a D-SNP. I mean, initially, I would probably want to say they wouldn't lose. They would actually gain based on what you just showed for the D-SNP benefits. Is that something you could speak to further?
Well, I'm happy to take that up. Yeah, so we're talking about those waiver services. You may have members, you may have heard of what the passport waiver, the Micro Ohio waiver, assisted living waivers. Those are just some of the waivers that we have in Ohio. And then there are other types of waivers that we have. And this is where the members are receiving specific services in their home. Yeah, and those are considered that's on the Medicaid side. And so a member signing up for our D-SNP, as long as they remain eligible for their Medicaid and those waiver services, they're not losing any of those services whatsoever. So they'll maintain and keep their waiver services as is. If they have a waiver service coordinator that they work with, they'll keep that person in their life. And, you know, our care management team can actually work with those waiver service coordinators as well. So the members aren't losing, they're not losing their Medicaid, they're not losing any of their waiver services if they wanted to sign up, you know, with the D-SNP. Paula, can you go to the next slide? I want to actually, I'm going to skip a couple and go to the next one. And this actually really kind of sums up a lot of what I'm going to talk about. You know, of course, we have, you know, those goals that we have for our care management program, which, you know, we've sprinkled throughout this conversation. But, you know, our program extends beyond just the traditional case and disease management programs. You know, we offer more personalized, comprehensive support. And 100% of all of our D-SNP members receive a care manager and a team of individuals that wraps around them, you know, kind of with that personal touch to assist them with navigating care. That care management team includes a nurse care manager, it includes a social worker, care coordinator, and a member advocate. That nurse care manager is, you know, the primary person that the member, you know, may coordinate with to talk through any of their health risks, or maybe the member is getting out of the hospital and need some additional supports and things like that. Our social workers help connect members to resources within the community. We all know that our population, you know, there may be some social determinants of health challenges with food insecurities, housing challenges, and things like that. You know, we do collect that information and help our members to find the resources and services that they need. And our social worker becomes very key in that process. Our care coordinators help members find a provider. They'll call provider offices to help members schedule appointments and things like that. And then those member advocates, you know, which we really appreciate as well, they help members really navigating those Medicaid benefits, making sure they're maintaining that Medicaid eligibility year after year so they can maintain eligibility in our D-SNP. So we have an entire team that, you know, wraps around that member. But not only that, we also have the support of our pharmacists, our medical directors, our behavioral health team, and also anyone else the member wants to be a part of their care team. So a member's caregiver, for example, family members, doctors, you know, things of that nature. And so every member is in care management when they enroll with our program, and they receive access to all of these different services and this team of individuals that really help them. Paula, go down a couple more slides. I want to talk about creating that personalized connection. One more right here, because as I said, we integrate care and coordinate across all specialties through seamless transition. So we make sure we're notifying the member's PCP. For example, if we're aware the member may have had a hospital stay and there may be a transition there, we're going to make sure the member's primary care doctor you know, is involved and knows what's going on. We want to make sure as we're gathering information about the member's individualized care plan that we're sharing that information where appropriate and where applicable. And so we try to make sure we are making those connections seamlessly across the healthcare spectrum and continuum for that member in an effort, you know, to make sure, you know, that we're resolving any barriers to care that that member may have. And you guys may hear my little girl in the background. I'm sorry, she's in another room, but you still may hear her. So I wanted to just highlight if you hear anything in my background. But our members have access to these services. And then, Paula, the next slide, I want to highlight for you all, because if you're talking to a member, if you have any questions or anything like that, or if you have a member that says, you know what, I can't find a doctor or a dentist in network, or I'm having problems, you know, getting something or whatever the case is, you have a resource here too. And I encourage you, you can reach out to this Medicare D-SNP email address for your questions to be answered. The one thing I will highlight too, and if our care management team was on here, because of course we have those HIPAA laws and things like that, there's some information that if you do send in an email, we will work directly with that member, and some information we cannot respond back directly to you. But we do reach out to that member, and we'll make sure that member is definitely taken care of. And so we can help you out with that if you have a member that's experiencing any challenges or issues. They're really good at answering any emails that come into this mailbox here. So please always feel free to, and even encourage the members, please, to reach out to their care management team, as well, if they can get that additional help in those resources. Paula, I'll stop there actually and see if we have any questions.
What questions do you all have?
I did get one question through the chat. I responded just because we're running short on time, but we'll just throw it out there. Is there any need for the agent to send the Medicaid contact information to Aetna for coordination? I mean, that's probably already known, so to speak, behind the scenes. Is that right? I mean, they can, but it's not necessary.
Yeah, no, we'll get insight into their Medicaid information, who's providing that care and things like that, and then
Right.
we work to make sure we have appropriate contacts at whether it's an MMP plan or with the state to be able to coordinate on the members' behalf.
Okay.
So no, definitely appreciate it. One thing that's very important for us is members' contact information. So please always make sure you have the most up-to-date telephone number or things like that. That really helps us out as we're working with the member.
Mm-hmm. Great, thank you.
So thank you. Thank you so much, Albany. Thank you so much for all being on with us today. We will be making sure that Colleen and Matt get a copy of this presentation so that you can need further information. And then remember, you also have contact with your local broker manager. We'd be more than happy to answer any questions that you might have. We appreciate each and every one of you. We're glad that you spent the time with us. And again, it can get a little bit complicated, especially when it comes to Medicaid. We have some really good, support here with Albany, having spent so many years on the Medicaid side. So there's a lot of stuff that she's gone through and, is able to assist us with. So we have a really great resource. If you have any questions, please don't hesitate to reach out. And we as a team here in Ohio, thank you so much for having us on the call and spending the time with us. You're very much appreciated.
Great. Thank you, everyone that participated. This is some really good information as evidenced by a lot of the really good questions. It seems to be, there's just always questions. So that's one of the reasons why we thought this would be some good content to bring to you. Like Paula mentioned, between your team at Cornerstone or your broker manager with Aetna, I'll be reaching out to a few people just to follow up on some of the questions, make sure you're all set. But in the meantime, I think we are a little bit over our time, but once again, thank you. And if you have any questions, just let us know at Cornerstone Senior. Anybody here can help you, or your Aetna broker manager. So with that, we will go ahead and close out this webinar. Thanks again, everybody.
Thank you. Have a great day, everyone.
Thank you.
Thank you.